I suffer from vertigo, so I made an appointment with an ENT in Texarkana. He did a number of diagnostic tests and determined that I had a carotid artery blockage. So he referred me to a vascular surgeon. In the meantime, this surgeon performed the vascular operation that I needed on my sister, and a week and a half later, she had a massive brain bleed. So I rethought my appointment and contacted my brother, who is a physician in Mount Pleasant. I said, well, who would you see if you had a carotid artery blockage? And he said, Dr. Robbins at Vascular Tyler.
We can go through the diagnostic process. We have on-site vascular lab testing, non-invasive testing, where we see the patient, we can then do the testing here, diagnose them, and then also in many cases, if it's a more minimally invasive treatment, we can actually do the procedure here in our office as well. So it's all under one roof. The vascular system is a system that supplies blood flow to your body.
Any interruption of blood flow could lead to death of an organ, so you have to be very quick about deciding what's going on. You have to also know the severity, so like in the case of peripheral vascular disease.
Varicose veins are a very common problem. The blood in your veins, in your legs, has to flow against gravity to get back up to the heart and lungs, so it's always working against gravity. And so you have valves that control that flow and direct it up the leg. You can have those valves fail. When those valves fail, you get back pressure building up in the venous system. That can cause varicose veins.
We start with an ultrasound. Ultrasound will give us a good idea of where the blockage is and how severe it is. Someone that used to be able to walk, say, a mile but can't walk a block anymore, we can do an angiogram, place a stent or an atherectomy, clean out the artery, and now they can walk a mile again. It can be very life-changing. So we like to say in vascular surgery that we're doing limb salvage, so we try to prevent you from losing your limb. Limb salvage isn't just about saving your foot, it's about saving your life.
Patient education is the most important thing. The patient needs to understand what's going on with their body and also have a good enough understanding that they can help make educated decisions about what is right for them.
So when we have that narrowing, it's something that right now we treat with medicines at this range.
My doctor with the VA ordered an ultrasound for my abdomen, and they sent me to UT Science Center to do that. During the process, they found an aneurysm in my aorta, and so they suggested I go to the emergency room because it's a very large aneurysm, which I did, and they said that they referred me to Dr. Robbins.
The primary care physician could call us and say, I've got this patient, I think you need to see them today. We're going to see them today.
A potential provider would need to know that here at Vascular Tyler, when they do refer to us, we make it a point to have a fast turnaround. If you send something to us, we want to make sure that we contact that patient as soon as possible. We pay attention to things such as stat referrals and urgent referrals, and even personal phone calls from doctor office to doctor office. That's very important to us. So we make it a point to make sure that those referrals, when they come in, that they're done promptly. We contact the patient as soon as we can. And also, I think one of the things that they love is that we then call the referring provider and let them know, hey, your patient has been scheduled. You don't have to worry about it. They'll be in soon.
Patients choose Vascular Tyler for the quality of care that we provide. The staff at Vascular Tyler are highly trained in their specialties. We have some of the best ultrasonographers in East Texas. We have some of the best clinic staff that care about the patients and their outcomes. We have the best receptionists and clerical staff that work hard to make sure that every aspect of the patient's care is dealt with appropriately. We are fortunate to have excellent surgeons here at Vascular Tyler. I've been practicing for over 20 years, and I'm very proud to be working with these doctors. Their clinical skills are amazing. Their outcomes are phenomenal.
It's rare that a situation can arise here in our office that we can't handle internally with the staff that we have. Our staff members, they love our patients. They want to take good care of our patients. They are receptive and responsive to our patients' needs.
I approach every patient the same. I want to treat them just like I want to be treated when I go to the doctor. I want to be treated like an individual. I want them to explain things to me so that I understand my disease process and I know what to expect going forward.
The last question that I ask myself is, what would I do if this was my mother or my father or my brother or my sister sitting here in front of me? What would I recommend for them? And I'm honest with my patients. I treat them like family and I treat them like friends. I love my time getting to know my patients on a personal level, and not just as a medical diagnosis.
Dr. Robbins and Dr. Miller are probably two of the best that you will ever meet. They love their patients. They care about their patients.
I take my job very seriously, and obviously when patients come to me, they're putting their trust in me.
I don't know of any other doctor or facility that gives the kind of care that I've had here. I have so much confidence in him and his staff. Vascular problems are such serious problems that you want the best to take care of your health. I highly recommend them to anyone who has a vascular problem.
The care I received at Vascular Tyler was very good. The staff is very polite and cordial, and everything went really well, and everything goes on time. You don't have to wait. Whatever your appointment is when you usually see the doctor. So I couldn't be happier with the staff here at Vascular Tyler. Highly recommend Dr. Robbins and Vascular Tyler for any kind of vascular needs you have. It's been a great experience.
At Vascular Tyler, we provide excellent care from a medical standpoint, but also we care about our patients from an emotional standpoint. We are available. We can see patients when they need to be seen. We can provide a variety of services under one roof, and our patients become part of our family.
Vascular disease is very hereditary. So if you've had a relative die of an aneurysm, or had a stroke, or if you have parents with varicose veins and you're having swelling, then you should come and see us at Vascular Tyler. We'll get you in and out, and you'll be happy with the experience.
Vascular Tyler's greatest strength is patient care. We love our patients. We aim to provide the best patient care every day from start to finish.